So we kind of did a different take on it, and we did a vision board of what we would experience in our version of the future of healthcare. So first, we wanted to go over the first sense is what you would see. So here's some of our ideas about, if you were to walk into a clinic or a hospital system, like what we would hope that it would look like in the future to boost employee health, physician health, patient health. So we'll start with the green space. So both outdoors and indoors, you can see like lots of windows and lights, and patients who are inpatient, like this picture here, you can see like the sun streaming in, and that's just like improving patient outcomes, getting the sunlight in the morning, improving like their sleep quality, and there's even been studies on like like delirium and all that kind of stuff, and then really helps them to feel more connected with the environment. And then so we also have an area to move, getting patients moving in some way, shape, or form. I know that's been touched on in the other system, so we also kind of had that idea of having a space for people to move around and exercise. And then we have pet therapy, which has been really well incorporated into medical schools and hospitals, and so to keep that going, I also included a dog, don't worry. And then so here we have, like we were just talking about, we have, it looks like a physician meditating outside as well. So he's grounding, he's meditating, he's taking care of his mental health, and it would be really cool for this to be practiced, and then for people in the system to also be seeing this. We feel like it would be really contagious to see all this kind of taking effect. And then lastly, this kind of made me think about our resilience talk, about two colleagues kind of like discussing what looks like was a difficult day for one of them, and so kind of being able to like discuss, difficult things, decompress, and like kind of share and like the shared experience, and being able to have someone supportive alongside of you and kind of go through it together. So just lots of that there.
That's great. And this patient room too, it's really important to have all the colors, which is really nice because even just being around that vibrancy can really affect your mood. And as Hannah was saying, the like windows, we've talked so much about how that can really affect your mood and the length of hospital stay. So we really want to focus on how can we promote wellness with the built environment in our hypothetical clinic. So next, who would you see? So we really wanted to focus on the allied health professionals. We don't want it to be a clinic where you walk in and just see a doctor and that's it. We wanted it to be a space where everybody could share and kind of like building like a maintenance health practice if you did walk in. So first we have our team of healthcare providers. They're all really happy, and they're, I love this picture because it's not like it's hierarchical. I think like really often, even when you see pictures of healthcare providers, it's like the male physician and then like the nurse is like sitting down and everybody's listening to him, but this one, they all look like equals and they're all part of a team and are happy. And then we also have other providers who can really help with health. So we have an acupuncturist here, we have a yoga teacher here, this one got really blurry. This is another one of all the professionals sitting together working as a team. Even like, how many times have you seen med students depicted like sitting as part of the team rather than like, hiding out in the corner, not included in the group? Like I've been part of that. So everybody's like an important valued member of the team in our system. We have a nutritionist because at that time, I think if a provider says, oh, this patient could really benefit from talking to a nutritionist, often they'll write a prescription and then it's like hard to follow up and you don't know who's in your system, who's in your insurance, but someone on site who can see the patient directly there would be a great idea. Some meditation leaders. And then sleep is important. If you want to rest while you're waiting for your appointment, things like that, we want the space to be able to make this like a very calming environment.
I think a big thing with that too is like just the residents being well rested, and Alyssa kind of touched on that with like not having those 24-hour shifts. And I know that there's a huge system involved in that, and there's a lot that would need to change, and a lot that goes into that. And some parts of the system that we could kind of work on would be honestly like increasing more residents. There's definitely a need for that, and I think people would be happy to fill those spots to give their fellow residents more time to sleep and take care of themselves. And I kind of wanted to put like these residents like being all happy after like sleeping, and just like showing like that would make such a difference for patient outcomes, for mental health in general for the residents. And I love that analogy with the cognition is the equivalent to having a certain blood alcohol content, and it really is a real issue and something that's being talked about a lot more. But I think that's something that we would want to see is like well-rested residents specifically, and everyone overall, but that's probably the biggest area where sleep deprivation is happening.
Might also see these individuals.
That's familiar.
Yeah. Hope we are ideal.
So you'd see them, you'd see everyone here. Okay, so then what would you smell? So we've all been to a hospital or a clinic and it smells like either like soap or hand sanitizer, or honestly just like, sometimes you can just smell like sickness, honestly, and I feel like it just like brings everyone down. And so like just to have essential oils, which we kind of talked about in class, and like having ones that are like, you know, good quality and actually boost health, like the patient that was cured of his headache by simply walking in, like could be really, really good for overall health. And then also, yes, so here's the essential oils. Here's like different, just like different types of smells that could be really soothing. And then also like the smell of healthy food. Like how many times we walk in and we smell like greasy food that the patient's eating and stuff. And like just to have like a kitchen, like a culinary kitchen where like you're able to create healthy meals, healthy teas with lots of spices, and just making that part of the culture.
And these, it's lavender, rose, and jasmine, and I looked those up, and those are like specifically different flowers that have a very calming sense. And I think when you walk into a clinic or walk into a hospital, like, I don't know about you guys, but I can feel like the anxiety and this fear and like the worry right as soon as you walk in. And so like kind of counteracting that and balancing it with some like more calming smells is a potential to just create a really nice environment. Okay, and what would you hear? I don't know, is it gonna let us click on the, no. Okay, but we have different playlists, and our idea was that like if you could walk into it, sometimes you're in a different mood. Sometimes you don't want to be listening to like really zen, calm music. Like maybe like you have a kid and they like, you know, you want them to hear some fun songs, or like maybe you're in the mood for some like jazz music. So like it would be really cool if you could walk into a room and be like, oh, like this is what I choose. So we want it to be very patient centered.
Escape, you might be able to do it. I don't know if that's nice it works.
I don't know if because I might have uploaded it as a PPA. Yeah. That's my fault.
Okay.
You kind of get the idea of it. And even like rain sounds too, if you kind of just like want to block out all the noise and again, all that fear, worry, anxiety in your brain, like rain sounds are really good at neutralizing that as like a sort of white noise. And it's classical pieces. So a good little variety, and I think making that patient-centered, there's a lot of options there.
I feel like that's so much more beneficial than too like having a patient. Lots of times you'll see like the news on, and I don't know, like I've been rounding and like I've seen like all these breaking news things going on while rounding, and for me that's distressing, and I can't imagine being like in a difficult health situation and then seeing the news and just being in a hospital in general. This could be a really great option. So like more soothing environment. And then what would you feel? So this one we just kind of like wanted to give the mood of like what you would feel walking in, and like a lot of that's just like contact and like a warm hug. So you know, you can see people like holding hands. It looks like they're praying together here, and I think that's like we had to touch on that as well, like really important. Something I've been really inspired to, like leaving this rotation, is just really to like hold the patient's hands, or like just be more like intentional, not just touching them for the physical exam, but to have that interaction, learning about the energy we can transfer and everything. Yeah, and then just kind of, you know, different modalities to like really like engage the patient, and just like have it be more than just like, you know, talking. Like most of this is most of communication is not verbal, you know, so just having all that kind of aspects there, we think would make a big difference.
When I was trying to put together this slide, I was looking at pictures of hope, and every single person, it was like this was a picture, fingers crossed. And I don't know that necessarily that's the vibe we want to give up. Like, you know, it's not like idealistic hope. We do like have a lot of evidence and a lot of practice and skills and expertise that goes behind the hope that we provide patients. So I kind of like that picture better, where it's like a freeing sense of hope. But yeah, there's even like some peace and some comfort, and even your body language goes a really long way. So incorporating that into how we can make our patients feel is really important. What would you taste? So we initially had some trouble thinking about this sense, but we were like, nutrition, we've talked about, is such an important part of being able to, of being incorporating health into your life. And so when you walk in, you will get a ginger candy just to, like help pre-digestion, post-digestion. We would have like a little tea bar where you could like we've been so lucky to have here, just something while you're waiting. There could be some healthy snacks. I found this picture of like a healthy vending machine, which is so great because in hospitals you see all the time these like vending machines and stuff that's been there for like years, and it has all these preservatives, and it's the most unhealthy snacks, even if it's like chips or those like Danish pastries, which who knows how long those have been here. And so like even just as simple like the message that we give off by having a healthy vending machine in a clinic can go a really long way, can help someone be like, oh my gosh, I forgot how much I like strawberries, but I had them in the doctor's office, now I'm going to go home and buy more, And then we also have a juice bar. So while you're waiting, you can have access to some of these different juices, and then, just some healthy food as well, just to kind of, we talked about how unhealthy the food in hospitals is, so just giving some more healthier options.
So, and then the big question is, how would you pay? And this is like such a complex issue. We've heard so many different modalities and different ways of doing it, and at the end of the day, unfortunately, a lot of people can kind of prioritize the finances and not, prioritize the patient care. So we put the direct primary care, that's something that we were interested in or kind of like thinking about, and it seems like that's growing, and I know we discussed it here, where, someone can pay, I was amazed by how much someone would be paying for their insurance per month. And so having like a flat rate of like what they know that they're paying would be super cool for them to come and prioritize their primary care and ultimately their prevention, and then hopefully not have to go inpatient or for more, acute treatment or anything like that, because they can prevent that with their lifestyle and with their maintenance and screening. One thing we were kind of talking about yesterday too, though, is like this can also be expensive, and insurance unfortunately doesn't cover this right now, as far as I know. And so if there is a way to get, the more primary care you pursue, the cheaper your insurance claim will be, because at the end of the day, the assumption is that these patients who are doing direct primary care to have better access to their physician for longer periods of time, which is such a great model, I think, they are still paying for insurance. So that isn't super cost effective yet. And so if there is a way for insurance companies to realize, wow, the more patients who are using direct primary care or just really utilizing their primary care physician and going more often, they're doing better and insurance has to pay less. If insurance companies could realize that and like basically decreasing the amount the insurance will cost for the patients because they are using so much primary care preventative strategies, could be a really great way to kind of like, I hope that made sense. I'm so confused about all this kind of stuff, but I feel like that sounds like a good way to make this more affordable, kind of like an incentive, kind of like the quarter thing, which is a cool idea.
And it's working in different insurances.
Yeah.
I was talking to a friend the other day, and she was saying like she has her car insurance has this app where when she's driving, they can kind of track if she's like picking up her phone or using it while she's driving. And so when she doesn't touch it and they know that she's not touching her phone while she's driving, then she like gets money off of her monthly like insurance premium. And so they're incentivizing these healthy behaviors and like safe behaviors with driving by using the insurance system to promote that. And so like, why can't we do that in the health insurance system? We're envisioning with our clinic like this, a lot of it is maintenance healthy practices. And so we're promoting, as the previous group mentioned, with preventative care, you're investing in your health in terms of healthy eating, healthy diet, regular acupuncture, these types of healthy practices that are gonna long-term probably save the insurance company money. So if you're able to show that you are attending regular visits and really caring about your health, why not? It's beneficial both to the patient and to the insurance company, and so that should be incentivized with, getting a little fee off of that.
You reminded me too with the insurance company too, like with the people one, I forgot to note, but I think it would be really cool to have more like physicians or medically trained people like involved in the decision making in that department, like with the insurance and stuff. And I think they would be the ideal people to know, like, wow, like if we can get more preventative measures, we actually know from our training that this will be a lower cost to us versus people there now who I don't think that they have those credentials as much and less of an understanding. And like this sounds too, but like they shouldn't be making those medical decisions because ultimately that trickles down to how the providers are treating the patients and how much the patients are spending. So it would be really cool to see more representation in that area. So.
Finally, our clinic has goodie bags. And so what would you leave with? We really wanted to focus on a lot of the things that we learned in this class and some things that it's not just like you stay healthy while you're at the clinic, you can also get tools and resources when you leave to be able to practice these healthy behaviors. So I forgot what these were called, but those little bouncy balls, I saw Alyssa had hers today. Stress balls, yeah. So like that could be a little treat. I was inspired by our trip to the herb farm where you can just take some turmeric to go. That could be an option. Maybe like a cold pressed juice, a sleeping mask. Really, those have been shown to help with sleep. And it's like a simple little takeaway. A gua sha to help with self-care. Maybe like an essential oil. We would have like a Mediterranean diet cookbook that maybe you could leave with. An orange blanket because we've seen how great those have been in terms of our wellness in this room and not freezing all the time. Maybe like a little tea bag. And then finally, we want to hear in our clinic, the most important thing for us would be patient-centered. So if you guys were visiting our clinic, the number one thing we want to do is get your feedback and hear about what you would like to incorporate. And that was something that we'd like to maintain. So any other thoughts, things that you'd like to see, things that you think are missing from our vision board that we can incorporate in and try and implement?